disorders. What are the challenges we are facing? First of all, lack of education among the staff of the prisons, then overcrowding, human rights violations, poor resources, limited healthcare resources, shortage of medical staff, unavailability of medicine, and generally poor access to the outside hospitals. Forensic psychiatry. Forensic psychiatry is a subspecialty that encompasses the interface between psychiatry and the law. It has special training in the area of mental health within the criminal justice system. Its primary objective is prevention of mental disorders, early identification of detainees suffering from the mental disorders, assessment of risk, harm to self and others, treatment of mental disorders. Referral and transfer to psychiatric facilities where specialized care is needed. Overall benefit of treating mental illness within the prison system. Number one, it provides ethical and humane treatment of prisoners who suffer from treatable illness, provides a safer and secure working environment for prisoners. Identification and treatment of mental illness can result in diversion of persons to more appropriate treatment settings. Due to lack of community-based mental health care, prisons end up functioning as de facto psychiatric treatment facilities. Then comes the current scenario in Pakistan, and especially if we are talking about Punjab. This year, more than 40 psychologists have been recruited by the Punjab prisons for working in the different prisons of the Punjab. There are 43 prisons. Some jails have regular psychiatric services, others have full-time psychologists. A prison information system is being developed, and all jails will be connected to a central system. In almost all the jails, 2 medical officers are available, and now the facility of psychologists, it is always also available over there. Moreover, lastly, in every prison of Punjab, a 20-bedded specialized ward is being constructed for the psychiatric patients for their treatment and for their confinement. And there are so many other such steps which are being taken in this context. Thank you very much.
Thank you very much, sir. Ladies and gentlemen, we have an eminent personality of Bahawalpur, Professor Dr. Niaz Maqsood, Head of Secretary Department, Bahawalpur Victoria Hospital. Sir, I request you few views if you can share with us, please. Ladies and gentlemen, Professor Dr. Niaz Maqsood.
Bismillahirrahmanirrahim. Would the Vice Chancellor, Chairman Department of Psychology, all distinguished guests, ladies and gentlemen, Assalamu alaikum. It is my profound privilege to be here to attend this conference. I had another activity in my own college that was already started at 11 a.m. But I was committed to be here as a gesture of sister department, because at the moment I am heading my department of psychiatry in Bahawalpur Hospital. And we are working in a very close collaboration regarding the trainings and the rotational training of the students from IUB. I extend my warm wishes for the success of this event, as these sort of activities give us good opportunity to interact, to socialize, have academic opportunities, and a good time. Thank you so much.
Thank you very much, sir. To extend some thanking words for our keynote speakers and participants, I request Professor Dr. Rubina Bhatti, Conference Patron and Dean Faculty of Social Sciences, the Islamia University of Bahawalpur, to say a few words. Madam, please.
Bismillahirrahmanirrahim. Esteemed Vice Chancellor, Engineer Professor Dr. Athar Mahbub, Guest of Honor, Dr. Mohsen Rafiq, Guest of Honor, Dr. Niaz Maqsood, our international keynote speaker, Professor Dr. Christopher, Professor Bruno, and Professor Ismail. All the faculty members, dear researchers and students, Assalamu alaikum, very good morning to all of you. I'm very pleased to welcome you all to the second international conference on interdisciplinary approach in social sciences. And this year we have a very important and significant theme, mental health for all, social determinants, challenges, and sustainable remedies. Well, I'm very glad that this conference is taking place at the Islamic University of Bahawalpur, because it provides us a very valuable forum to highlight various important matters relating to mental health for all segments of society. Such experts' discussion in interdisciplinary perspective will surely help us to identify various important factors like challenges, barriers, so that we could discuss and find sustainable remedies, and we can find the way forward. As we all know that mental health is a global issue. If we see the statistics worldwide, in USA, every 1 in 5 adults have some kind of mental health issues. And every one young person in 6, they are experiencing some kind of mental issue. And same the ratio we are getting from UK and European countries. And if I talk about Pakistan, about 20 million of the population in Pakistan, that makes about 10% of population that have been suffering from mental health disorder. And this situation makes it even worse if we see the ratio of psychiatrists to patient ratio in Pakistan. We have got only 400 psychiatrists in Pakistan and only 5 psychiatric hospitals into Pakistan. So if we see that mental health is not only about mental illness, it's about maintaining a positive well-being. So what we need to do, we need to normalize the conversation about mental health problems. And that empowers people to share about their issues and cope with their problems and to get the help what they need. This is a very important issue, but unfortunately this has been for granted due to certain issues, certain taboos and stigmas in the society. So the purpose of this conference gives a very clear message that please don't suffer in silence, and you are not alone in this struggle. So for discussing the very important themes of this conference, we have important keynote speakers from all over Pakistan and from other countries. They are going to discuss many important themes, and the main purpose is that we need to convey the message that mental health issues affect people of all walks of life. Men and women from different ethnicities, all cultures, different socioeconomic backgrounds, different cultural backgrounds, mental health problems of students, youth, domestic violence, transgender, people with special abilities, and minorities, immigrants, and many other marginalized communities and so on. So I hope that this discussion will help us in finding the social determinants and challenges and possible practicable solutions, so that we could maintain the policy further and give solid recommendation to the policy makers. If I talk about the Islamic University of Bahawalpur, under the leadership of the Vice Chancellor, Engineer Professor Dr. Adil Mehboob, we have addressed this issue. And Department of Psychology has already taken many initiatives in this regard. And in the Islamic University of Bahawalpur, an enabling center has been established under the leadership of the Vice Chancellor and all his team. And the purpose of this enabling center is to have students, faculty members and employees and all the community of the Islamic University of Bahawalpur to cope up with their issues, to share their issues and get the guidance and counseling they need. So I think that is the main thing is that the academia is focusing upon mental health information literacy. And academia is playing a role, we're conducting research. The thing is that we need to take initiative at a higher level. For this we need sound organization and sound policy. At the same time, we need to establish support groups, community support groups, who can provide counseling and guidance. And social media can also be utilized for self-purposes. And I hope that will make a real difference. I'm very thankful for the conference presidency and also our partner, Punjab Higher Education Commission. The director of Punjab Higher Education Commission was going to join us, but unfortunately he's busy in his meeting in Islamabad. He will join us tomorrow, inshallah. So congratulations, Professor Dr. Salim, conference chair, all the organizing committees for putting together this wonderful conference. I wish you all the very beneficial and stimulating session. Thank you so much.
Thank you, madam. Ladies and gentlemen, there is an announcement that we have book fair inauguration after this ceremony, opening ceremony. And this session will remain continued, and students will stay here after this ceremony. And Wadi Vice Chancellor will inaugurate the book fair. Now I request the Patron-in-Chief of the conference, Engineer Professor Dr. Adil Mehboob, Wadi Vice Chancellor of the Islamic University of Bahawalpur, to share his views about the importance of the conference. Ladies and gentlemen, please welcome Engineer Professor Dr. Adil Mehboob, Vice Chancellor of the Islamic University of Bahawalpur.
Thank you. Thank you. Bismillahirrahmanirrahim. Professor Dr. Rubina Bhatti, Dean, Faculty of Social Sciences, Islamic University Bahawalpur. Professor Dr. Muhammad Salim, Chairman, Department of Applied Psychology, Islamic University Bahawalpur. Our very respectable international and national keynote speakers, Professor Joselito O. Banono Jr. from the Cebu Institute of Technology, University of Philippines, Professor Dr. Christopher Allen Lewis, Department of Psychology and Therapeutic Studies, Leeds Trinity University, England, Professor Dr. Rosmi bin Ismail, Psychology and Human Wellbeing Research Center, Faculty of Social Sciences and Humanities, University, Kermansan, Malaysia, Dr. Khan Mohammed Raziuddin Tawfiq, Oxford Brookes Business School, United Kingdom. Mr. Mohsin Rafiq Chaudhry, DIG Prisons, Multan and DG Khan region. Professor Dr. Niaz Maqsood, Chairman, Department of Psychology, Bahawal Victoria Hospital. Deans, chairpersons, delegates, and dear students. Assalamu alaikum. I am highly motivated to see this auditorium full of enthusiastic young students who have come to this second international conference on interdisciplinary approach in social sciences, where the theme for this year is mental health for all, social determinants, challenges, and sustainable remedies. I am indeed very happy that we at Islamic University of Bahawalpur are not only growing, but we are growing, as far as I see, in an organic way. And I would like to share with the participants and the dear students that it is not only about theory that we care, and it is not only that we preach, but we believe that actions speak louder than words, and we believe that in theory there is no difference between theory and practice. However, in practice there is. So, for the students who have joined the discipline of applied psychology, what you will see here, and I will present to you how the knowledge of applied psychology is not only being taught at your department, but it has to be practiced, and it is being practiced at the university. I would like to share some of our initiatives and efforts in this direction. For example, when we revised the curriculum of all our undergraduate degree programs, and we brought in a standardized general education curriculum, there are two very specific courses in there that every undergraduate student has to take, which try to build the students' capabilities in applied psychology and mental health well-being. We have a course called Life and Academic Skills, in which there are modules related to understanding your own self, how to manage your time, how to manage relationships, how to manage stress, how to plan your studies and your educational career at the university, how to prioritize things, how to work in teams. The other course is Basic Health Awareness, which has specific modules on mental health well-being and understanding yourself and how to avoid the harmful substances and how to take care of others. Because mental health, I believe, is related to public health. The health of the whole population depends on the mental health of the individuals. Because even though it is not classified as a contagious disease, but mental health disorders are most disruptive in nature if they are not handled correctly at the individual and the collective level. Considering that the problem of mental health has become more complex in the face of the modern society, where due to technological advancements, the structure of the family, the support structures that we used to have been transformed. The society has been transformed into urban societies. The pressures of professional work environments, where the pressure is to prove yourself and you get less time to give to your family members. So the problems of mental health have become highly complex and challenging. So the other step that we took, we realized that social sciences need to be given due importance at the university, and because of the interdisciplinary nature, the social sciences need to be clubbed together. So we did not used to have a faculty of social sciences at the university, but 3 years ago, we established the faculty, and I'm very happy that Professor Dr. Rubina Bhatti, the first dean of the faculty, shares the worldview about the Faculty of Social Sciences and the various disciplines that are part of it to work together. We also established the Department of Public Health at Islamic University of Bahawalpur, and the Department of Public Health is leading many initiatives related to courses in the public health, like basic health awareness, mental health awareness. In addition, I'm so happy that faculty members from the Department of Applied Psychology also established the Enabling Center, so that we can provide 24/7 support services in mental health, counseling to our students, and clinical psychologists are also available on duty to be able to provide clinical help where necessary. In that endeavor, we are also cooperating with like-minded organizations working in the society. So a major part of the university, the Department of Applied Psychology and the Faculty of Social Sciences has been to work with partners in the government, in the industry, in the academia, both locally, nationally, and also internationally. And this conference is one example of that. I would like to appreciate the cooperation and facilities extended to us by the Bahawal Victoria Health Hospital to allow our students to practice some of the theory that they study. I am grateful to the BBH administration and Professor Dr. Niaz Masood for providing us, the students and the faculty, opportunities for training and collaboration. I would also like to mention that our Rahim Yar Khan campus is also very active, and with the collaboration of the Sheikh Zayed Medical College and Hospital in Rahim Yar Khan, and in particular through the collaboration extended by Professor Dr. Burhan Mustafa, they are taking many initiatives in mental health well-being, applied psychology, cognitive behavioral therapy, and they have also launched a certificate program. I would also like to mention that through establishment of student societies, we are engaging our students in a wholesome personality development. So they learn to work in team environment, they learn to both collaborate and compete through various sports activities, and the whole objective is the self-actualization. So like a well-tuned automobile engine, it performs optimally, so your fuel consumption is ideal, your acceleration is ideal, your brakes are ideal. So same way, even though the analogy might break down in certain cases, but if all our individuals in the society are well tuned and we have systems in place, so whenever something is not performing optimally, appropriate help is available to help each other through structured and non-structured approaches, so that all of us can perform to the optimum level. We can attain the self-actualization and contribute with our lives to make not only our own lives better, but the lives of those around us better. So with these words, I would like to once the efforts of the Department of Applied Psychology and all other team members at Islamic University Bahawalpur. I would like to appreciate the delegates who have come from all over the world and all over the country, from other provinces. It's a very good platform to get to know what different people are doing in the field, to learn from their knowledge and experience, and to be able to work with them further and collaborate. So hopefully together we'll realize our shared objectives and translate the theory that we learn into a practice which will benefit us all. Thank you very much.
Now I invite worthy Vice Chancellor to present the souvenirs to our guest of honors and keynote speakers.
Please come forward.
Looks good. वो एक्चुअली इस्लामिक कॉन्फ्रेंस के लिए कर रहे हैं.
First of all, I request Mr. Mohsin Rafiq Chaudhary to receive his souvenir from Honorable Vice Chancellor. Thank you, sir. I request Professor Dr. Niyaz Masood to receive his souvenir from Worthy Vice Chancellor.
शाम से नहीं वो बिल्कुल शाम भी है पागल आप वो बच्चों को बच्चों कोई उससे मेरा ख्याल है.
Now I request Professor Dr. Josito O'Connor to receive his souvenir from worthy Vice Chancellor.
It's a kind of an avoidance for conflict.
Now we request Professor Dr. Christopher Allen Lewis to receive his souvenir from worthy Vice Chancellor.
मैं क्वालिफाइड टीम में नहीं हूँ. मैं ये चाहूँगा कि अगर आप इसको
That's all from my inaugural ceremony. Our session will continue with our other notable keynote speakers. There is another inaugural ceremony of book fair outside the auditorium. So, Worthy Vice Chancellor has to elaborate the book fair. Our all students are requested to remain in the auditorium so that we can continue our next session with notable keynote speakers.